Okay, we're going to get started and I'll just let people in as they come. As a reminder, if you are not presenting, please ensure that you are muted so we can reduce the background noise. I will introduce our presenter to everyone today very quickly, and then I will hand it off to him to walk us through this presentation. So today we have Dr. James Farmer. He's an associate professor of food systems at Indiana University's O'Neill School of Public and Environmental Affairs. Dr. Farmer studies local and regional food systems development with special interest in consumer behavior in relation to farmers markets and CSAs, food justice, and farmer behavior in decision making. He teaches classes on sustainable food systems and sustainable agriculture in co-directs the IU Campus Farm, convenes the IU Sustainable Food Systems Science Initiative, and is the acting director of IU's Food Institute. He will discuss research surrounding local food accessibility at farmers markets and CSAs, drawing from Indiana-based scholarship. He will also highlight examples of organizations seeking to remedy food injustice through alternative market strategies and market policies focused on the eaters and farmers. So I'm going to hand it over to you, Dr. Farmer, to get us moving.
Well, hello and good afternoon. Thank you all very much, and pardon the delay. It was entirely my fault. I am the most unsavvy technological person. You'd think after 2 years of a pandemic, I would know how to use online presentation platforms. But alas, my video is not working, but at least I can share my screen. And so very much want to entertain questions, and I apologize I'm not able to see who's in the group, but hello everyone, and thank you for coming. If you don't mind, if there's sort of a clarification question, I'm happy for that to be put in the box. And Megan, feel free to interrupt me. But like more sort of larger discussion questions, if we can just hold those to the end and we can have a good conversation, I think there'll be plenty of time for that. I really appreciate the invitation to talk on this topic and understanding barriers within farmers markets. And I've added a bit of a subtitle because this presentation is really about the customers and the patrons as opposed to the farmers, because it's an entirely different ball game that we could get into. But this is a really critical issue that I'm learning a lot about, and hopefully others are as well. So thank you all, and thank you to the State Department of Health for inviting me. This, to me, is a really important venue for this work to be shared. Just a little bit about me. Like Megan said, I'm at the O'Neill School down here in Bloomington. And my on-campus activities beyond teaching and research is with the campus farm, which is a passion of mine that started at Earlham College when I was there working with those students on their campus farm. And then off campus, I also am involved with Monroe County 4-H and at Twin Springs, which is our little farm that we have. And I've got 3 kiddos that are involved in both. So that's a little bit about me. I also want to acknowledge all the good people that have participated in this research, in farmers market research, CSA research, etc., as well as the team members on these projects that I'm going to talk about today, and the funding that supported this work from the Indiana CTSI Community Enhancement Program, as well as the USDA through the ISDA, the Specialty Crop Block Grant Program. This work obviously would not have been completed if it was left up to me and my individual resources and my time. So I thank all the folks that have been engaged with this over the years. So I also want to acknowledge that I am very much new to this work, and in recent years, I mean, obviously I've been studying farmers markets and such for a while, but really starting to look at equity and justice issues, I've really leaned on a couple of different areas of literature. One's from Dr. Monica White at the University of Wisconsin-Madison, and then Leah Penniman and her work and her writing from Soulfire Farm. And then the People's Market down in Bloomington, and learning a lot from them. So I'm obviously there are others, but I just wanted to point out the folks that I'm learning from as I move forth in this line of research and engagement. I want to just quickly outline what I'm going to be discussing today, and the work spans over, these studies actually span about a decade, so I don't want you to think I conducted them all in the last 12 months. But I want to get into two research projects that we worked on. One was a statewide study that looked at farmers markets all across the state, up from Goshen on down to Madison, Indiana, and from east to west. And so that one's a little bit older. But I'm getting a little reverb here. Sorry about that. But that one's a little older, and but I think there's still some important lessons to learn there. The other one mostly focused in Bloomington, in which we did some work in a couple of different neighborhoods and at the farmers market. And obviously, I know Bloomington's a bit of a weird and different town, but also I think there's some important pieces that we can take away and talk about there. And then we'll open it up for more discussion and Q&A there at the end. So that's sort of like where I'm going with this presentation today. So these studies, I just wanted to point out that one was with the Specialty Crop Block Grant, and the other one was with CTSI. Basically, I already discussed this items. And yeah, thinking about these issues and understanding these barriers, I think one thing to point out before I go any further is farmers markets are not a panacea. And I believe sometimes we have these expectations that they're going to be like the end all be all food solution for food acquisition and distribution, that everybody wants to go to farmers markets. I kind of, even myself, even though I study these and I've been to 40 different farmers markets over the years, I don't always want to go to farmers markets. And I know there's some people for various reasons or various barriers that exist. I mean, not everybody wants to engage at a farmer's market. So I just want to I feel like oftentimes in the conversation, we're like, everybody needs a farmer's market. Everybody needs to go to a farmer's market. And from my own personal philosophy, that's I no longer, I think I probably thought that at one point in time, but I no longer think that. And so just thinking about how can we make markets available, accessible to people that actually want to engage with markets is so where I come from. And if we look at the current numbers in Indiana, and thanks to Indiana Grown for having data available in the USDA, there's 8,000 plus farmers markets across the U.S. I think it's about 8,300, and this is a few years old now. And to give you some perspective, in the mid 1970s was sort of the low point in farmers markets. In California, often we looked at California as the mecca for like local foods or what have you. But in 1979 there were 6 farmers markets in all of California. Now there's 729. In Indiana we've seen dramatic growth across the state, with really starting to expand in the 90s, but really again the low point being in the mid 1970s. We're just having a handful of markets left in the state. I will note that from my research, and correct me if I'm wrong later, but the Madison market is the oldest, longest running farmers market that I'm aware of in the state. So it's pretty cool to acknowledge that. But Indiana, we're up to nearly 200, and that was data that I found yesterday on the Indiana Grown website and looking at USDA data. So I think it's continuing to flourish. If we look at the literature, just pulled up a couple of different studies looking at barriers to farmers markets, and I've highlighted a few items, and 2 in particular that really stand out. One is transportation, and the other one is financial access, costs, acceptance of assistance vouchers, say SNAP, WIC, etc. So these are the 2 primary issues that I've seen across being discussed in the literature as important that we need to work to alleviate the problems with and minimize in order to increase access. And these, you can see here, we've got a national review. It's a literature review that was nationally done about 6 years ago. We have one from the state of Washington, one from the DC Charlotte area, and one from Illinois. So, and then I'm going to get into some of the weeds here in Indiana. The research objectives for this work is trying to figure out who is and who isn't engaging in local foods systems. And like I said, I've studied farmers markets and CSAs, but today I'll just get into the farmers markets. I want to know why. That's a big question. Is why are they are, why are they not? Second is to develop an understanding on the sense of interest amongst food insecure households for local foods. Like, is there actually any interest? Or are we just painting this picture like everybody needs to be doing this, and while some people might not want to be doing this. And then finally, examine sort of the efficacy of farmers market double market bucks program, which I know a lot of communities now have an opportunity, and it's a great resource to be doubling SNAP benefits, SNAP vouchers, and folks actually getting able to buy a lot more at the markets they attend. So study one, they're trying to make you all visually car sick on a screen. Study one, took place in Indiana, and the yellow pins are the various farmers markets that we went to. They randomly selected, and we were able to get to those markets and collect data in person, handing out paper surveys, as well as some envelopes with stamps, and people would mail them back to us. So we attended 12 markets. And we also sent out a survey to 750 randomly selected Indiana residents, and actually got 117 people that actually do not participate in farmers markets. And so we're able to do some comparison of people that go to the farmers markets versus people that don't. And so that's where this data is derived from. And I want to highlight here, there's some major differences in our farmers market participants and our non-participants. If we look at household size, the percentage without any kids, if we look at sort of that setting they live in, more non-participants were rural than participants, educational attainment levels, some drastic differences there, and then an income level, which if you think back to that current literature slide, you can see that coincides with some of the financial barriers that are discussed within the literature. Now, one part of this research looked at sort of these food value statements, and you've all probably taken a survey, got something in the mail where you have to strongly agree versus strongly disagree with the statement, and I can be blamed for part of that, badgering you with the surveys. But we had several statements that surrounded these topics, and I am interested in environmentally sound foods. I am interested in highly nutritious foods. I want to support the local economy through my food purchasing, et cetera, et cetera. And as you can see, the farmers market participants scored much higher, with 5 being the strongly agree and 1 being strongly disagree. You can see denoted with the italics and the star that there's significant differences between the scores of people that attend farmers markets and those that don't. Now this is I'll admit this is a bit of a gobbledygook slide here, but I want to try to explain it in a meaningful way. Basically, we did what's called a logistic regression, where we put several variables into an equation, and we tried to figure out what are the key variables that are basically allowing people or causing people to go to a farmer's market, or are highly correlated with people going to a farmer's market versus people that don't. And so what you see in the bottom part of the slide are the motivation for acquiring organic food, or motivation to buy food within a 100-mile radius of where you live, are key values and motive values, if you will, of reasons why people go to a farmer's market or want to shop at a farmer's market. Educational attainment level, as education dropped, as you drop from, say, having a bachelor's degree to not, or having a master's degree to having a bachelor's degree, you actually, the odds of that person going to the farmer's market decreased by almost 83% by each level they dropped. If you knew somebody that went to the farmer's market, and this comes to that cultural fit and that social norm, when we think about social norm behavior, for every time you knew an additional person that went to a farmer's market, because we asked people, how many people do you know that go to the farmer's market, and they gave us a number, 1, 0, 25, whatever. So for each person that go to the farmer's market, your odds of going increased by about 65%. And then finally, for every mile you lived further away from a farmer's market, and we were able to map, we're able to calculate the distance people were from their market, your odds of going to the market decreased by nearly 7%. So that gives us this slide, which really points to some strong correlations and effect here with these variables on educational attainment, distance to market, your social network, the value for organic foods, and value for local foods. But it's not quite done here. So other lessons that we learned from this earlier work was nearly 25% the people we surveyed that were the non-participants had no idea where a farmer's market even was. When we compared the non-participants to the farmers market participants, the non-participants lived about 7.8 miles from their market, from the closest market, while the people that actually go to the market lived about 4.36 miles from the closest market. Saturday, we learned from people that Saturday morning doesn't work for everyone. It doesn't work for a lot of people, whether it is you're working on Saturday morning, whether maybe you work the third shift the night before and so you're sleeping on Saturday morning, or maybe you have kids that are involved in some soccer, lacrosse, what have you, and it's your time to engage in those activities. Then we also learned from people the need for increased need for WIC acceptance and EBT acceptance and for electronic transaction options. Public transportation, and if I point back to that slide that was showed the literature from across the U.S., that is a key factor of thinking about the location and transportation options for people, particularly if you get into a more urban setting. Product cost jumped out as the key element that people discussed with us, and the price of food at farmers markets. The variety of product options. They also were more interested in markets that had a variety of options. And then finally, culture. Was focused Bloomington. Just gives you some background information. According to Kim Meter, it's one of like sort of the origin of local foods in Indiana. I'm guessing everybody on here will argue different, be like, no, it was in my community. So I understand we'll take that one with a grain of salt. But and it's also just acknowledging that it's Indiana University's flagship campus, and so that has a major impact on the scene in Bloomington. So it was established in 1975. Again, this was sort of that low point in farmers market, and depends on when we look at the data. At the time of this research, they had about 75 plus vendors in attendance, sometimes over 100, 10,000 visitors on any given Saturday. Now, obviously, there's been some major shifts, and Bloomington has several different markets, 5 or 6 different markets in the county now. So these numbers would not be the same, but I wanted to report what they were when we did this research. And obviously you can find some classic Indiana cuisine as well as some international options. Bloomington, we wanted to work here because I had more knowledge on the Double Market Bucks program, which was implemented in 2013. Which was at the time was funded completely by a private donor who would help match when people would use their SNAP benefits there. So part of this was trying to understand like how much Market Bucks programs decrease financial barriers and enable people to engage at the market. With this project, we also employed a community-based participatory research model. And there are actually 4 total phases. I'm only getting into 2 of these on this presentation, but the key was we were engaging people as non-professional researchers, members of the community in this research project to try to come up, to try to do work that was more applied, that was more useful, that would benefit individuals outside of higher ed and the journals that we normally publish in, and work that could be used to help improve situations like the local food system, wherever it is, and this is in Bloomington where we're conducting the research. And so we worked with Monroe County United Ministries and Cliff Eden specifically. We worked with the local Growers Guild, which no longer exists. We worked with the City of Bloomington Parks and Rec, and then a handful of others to conduct this work. So the first bit of work we did was focused in 3 different neighborhoods: the Crestmont neighborhood, Reverend Butler neighborhoods, the Highland Village area, and then Walnut Woods, which are lower income and also middle income with Section 8 housing in these neighborhoods to try to capture individuals who may be financially challenged with engaging at the market. And so that was part of the impetus for going through and doing these neighborhood interviews. So you see on this in this table, we compare the mixed income neighborhood to the low income neighborhoods, and we see one difference in people's desire to acquire food that is chemical free, if you will. And that's the type of food that they sought after. But everything else, pretty much, there was no statistical difference between the two. And then we compared the farmers between, like, we put those two groups together, that mixed income and the low income, and then we also asked the question, do you go to the farmers market or do you not? So that's where we got the two columns on the right. And we compare those. Really, the only difference is the people that attended the market also indicated more highly that they wanted fresher, maybe looking at quality a little bit more than our non-participants. However, you can make the argument that the non-participants were very much interested in that too. There just happens to be a statistical difference here. And again, another fine slide of gobbledygook. But we'll just throw out that when we threw all the variables in the kitchen sink into an equation, it told us that those people that don't go to the farmers market indicate having greater difficulty in getting to the grocery store, and those people that do go had a higher likelihood of keen interest in fresh quality foods. So that's what this slide provides for you. The people that we interviewed, and we call this interviews because we went door to door. Again, thanking the students and the students that I worked with, undergrads and grads, to do this work. They indicated, the people we interviewed indicated an interest in local foods as well as whole foods and raw foods. The food values that seemed to be of greatest interest were healthy local food and food that was economically cost effective, as well as easy to prepare foods. And then finally, difficulty in transportation. I just want to underscore how critical that is and how significant that is as a barrier to attend the farmers market. And so then if you put in the perspective that, okay, I'm only going to be able to do some of my shopping in the market, but I'm going to have to go to at least one other place to procure all the food I need to for the week or for the next couple of weeks, it really does make an impact on why you would or would not choose to go to the market. So the second part of this, when we actually set up a booth at the market and we are collecting data from people there that were using their SNAP benefits, as well as just people there that did not use SNAP benefits, we were able to learn quite a bit. And so what you see is, when out of all the people we asked that used their redeemed SNAP benefits there at the market, 86% of the people actually participated in the study amongst those, and nearly 62% of the non-SNAP benefit users. So we got a pretty good response rate there. Most of the people engaging with us were female. The average age was 42 and a half, and that seems young to me now because I'm now older than that, but I wasn't at the time. And then they visit on 2.5 times per month, and they have more than two people members in the household. So that gives you a little bit of idea of where they're coming from. Okay, this slide, what I want to point out is when we look on the far right, and these are you see the columns, the right two columns. When we look at this, I guess we call a second one from the right, the p-value between farmers market SNAP and non-SNAP. This is really comparing those people in that farmers market data. And so if we look at their age, there was a difference in age. If we look at the household size, there was a difference there. If we look at the number of children in the household, that was a very significant difference, as well as educational attainment level. And so we can see that there's some major demographic differences if we look at household income. And some of this stuff isn't a surprise because obviously education is highly correlated with income. And so we have some obvious outcomes here. When we look at the purchasing behaviors at the farmers market of people using SNAP and non-SNAP, we see some pretty significant differences if we look at meat and dairy purchasing. So those people that are using SNAP benefits at the markets are purchasing other dairy. They're more likely to purchase meat than our non-SNAP users. So what I find interesting here is, generally speaking, our SNAP users are able to buy a different variety of products than our non-SNAP users while attending the market. And this slide is, I think, pretty interesting too, because statistically it shows a growth rate of frequency and like sort of the, how the numbers were working out when people started going to the market. So we see those people that use SNAP benefits are in blue on the blue line, and those people not using SNAP benefits are on the green line. But essentially, the growth of both are going to the farmers market is quite parallel and happening simultaneously in sort of an equal extent. So a few discussion points, sort of take-home points that I want to bring out here. One from this, looking back to that first study that was at the 12 different farmers markets, one thing I can say is farmers market participants in our study embody the demographics of a very professional, privileged class when compared to the non-participant data. And when we look at Indiana census data, I mean, it's people that are highly educated when it comes to educational attainment of master's degrees, of bachelor's degrees, of doctoral degrees, etc. It's people that definitely have higher incomes, and so there's definitely a higher. If we look at sort of the currencies of privilege, the group that engaging at the farmers market is much more likely to carry more of that currency. Economic barriers to farmers markets can be challenged through the acceptance of these programs. And at the time, and in some markets, those are still not readily accepted, or they're just getting into that. Another key takeaway is the desire for community and the building of relations. And this is a bit of a working hypothesis through some of the conversations that we had with people and learning about their in what they get out of the farmers market. So one of the articles that we wrote about it, this project, was sort of the leisure experience in farmers markets, because what I found fascinating was many people were going to the farmers markets for that social engagement, for the recreational aspects of it, as opposed to buying food. Because if it was just food that they wanted, just plain food, any kind of normal food, they could go to the market and it would be a much more expedited experience, and they're probably going to save time because they're only having to go one place to shop. However, the people that we're surveying, the people that we interviewed, also talked about that desire to engage and to see people that they're their friends or their colleagues, and to maybe church members, and to engage and build community. And so when I look at the literature, I can also point to the amount of social capital that gets built, which is an important currency, because it's part of people's social network. But also, if we think about those people that aren't able to access the market, be it for financial reasons, for transportation reasons which are tied to financial, cultural fit reasons, they are to build that cultural capital or that social capital, because they're excluded from those markets. Another thing that came out and was pretty apparent was a distrust, whether it's perceived or founded or not, of the current industrialized food system. And so people were looking to markets and looking to local farmers to build transparency and access food that they felt was more aligned with what they sought. And again, the cultural fit. And it's interesting in talking to people and learning about how they did have a perception of well fitting in a market, and how it was a groovy place to be, and it was a place that they could run in and they could spend hours just congregating, and then talking to other people that discuss not seeing themselves at the market or not seeing anybody that they knew at the market. And so it created definite barriers to their interest and willingness to engage in that venue. Now, for study 2, one key is individuals of low income are interested in healthy food options, because there's conversation out there that people of low income don't care, and that is obviously not true. And if you look more at the literature, we find many people concluding this. But what these people did tell us is it needs to be affordable and relatively easy to prepare. But the key is, for many of them, the transportation was the crux of their ability to engage and if they wanted to engage at the farmers market, their ability was hinged upon transportation. And when public transportation wasn't available, and you don't have reliable personal transportation, then this becomes a critical issue. Another take-home point is the SNAP users at the Bloomington Community Farmers Market at this time we're not honestly that dissimilar from the average market goer, especially when it came to their environmental values or their local food, local economy values. And they told us that, because one question we did ask is, would you attend the market if the SNAP benefits were included and they or weren't accepted? And they're like, absolutely, hands down. More times than not, people were willing to attend the market with or without the SNAP benefits. The market bucks were a great addition, and the doubling of market bucks, obviously. So I very much encourage people to keep doing that. But it wasn't a silver bullet in getting people to the market and to engage at the market. It does help remedy some issues, but it doesn't obviously help remedy all the issues. And so when I look at some solutions to this, one is, when we're trying to address these equity and, obstacles and barriers, transportation to me was the resounding thing that came from our data. And so one thing is thinking about, how do we develop markets in diverse locations and along public transportation corridors? So one market that we're fortunate to attend and collect data from was the 38th and Meridian Street Market. And I took the screenshot out of the Indianapolis Star. It's from a few years back. But you can see it's called the North Church Market. It was set up in a church parking lot. It's on first, third, and fifth Thursdays of each month. So there you can see they're doing something a little bit different. A, they're in a church parking lot. B, they are doing it on Thursday evenings instead of Saturday mornings. And so you can see something a little bit different. In talking to them, the benefit of doing this at the church parking lot, and this is a little, this is 10 years ago now, was the fact that they had a location that had facilities to it. It wasn't just like in a quarter crossroads without any extra facilities. And at the time, and I've not spoken to them in a while, but there was an opportunity to, for a lot of, collaboration. So I would say socioeconomic issues are of critical importance. So a lot of, I mean, there are racial issues when it comes to the makeup of the markets and who the market is culturally sort of attracting and open to. But and I would also say there are also a lot of economic issues. And our data points to social class as much as anything being a critical barrier. And so I also brought up this screenshot of a couple of different markets, a little more rural, if you will, and sort of the outskirts of Indianapolis. But you can see that, down at the bottom, the Plainfield Market is at the Plainfield Friends Church meeting house there. And it's on Wednesday. So again, choosing a time that's not that traditional Saturday morning. The Brownsburg Market's on the Village Green or the Town Hall Green. And that's also on Thursday night. So again, pointing these off times, I think, is really, really important. And thinking about where the markets are positioned, because while you can point to the Plainfield Friends Church, or you can point to the 38th and Meridian Street Church, sometimes for some people having at a church is a major turnoff. So we got to think about, like, where are these positioned, and are these accepting and open spaces? Are they spaces that are discouraging to some groups? There's a market in Southern Indiana that I know is in the parking lot of the county correctional facility. And so for some people, that is not a place where they want to go for a variety of reasons. So thinking about how that location is an important consequence. So when I look at the literature, and just these pictures are not mine, but I took them, borrowed them from offline, and credit the sources here. So some ideas that are discussed are, how do we connect across communities? So while you might have certain individuals, maybe it's the farmers that are organizing the market, but how do they connect across the different community groups within the area that they're serving to enhance access, to understand the barriers that are they're infringing upon engagement, and help remedy those issues? Secondly, a lot that comes from the literature is talking about a sort of shared power and ownership and responsibilities. So shared governance. So it's not just the same traditional people that have been in power, maintaining their power and their control over the market, but how do we engage across again, with these various community groups, and making it more an inclusive and an equitable space. I would also say that there are many different models, and so don't hesitate to support varying styles. There's like, there's there's sort of these low governance models, which are a handful of farmers get together at a crossroads, and they put up their tables and their easy up tents, to a space like in Richmond, Indiana, that was built across from the public library, that was built and well designed, and a very nice and park that the farmers market takes place. Everything in between. You have markets that are more focused on food justice, and so they present opportunities to engage individuals in various ways, and then challenging the status quo. So even though your market has been doing something for a long time, doesn't mean that there's not problems with it. It does not mean that there's not gaps or holes that should be dealt with or challenged, and work within the advocates in your community and your varying stakeholders to help remedy those issues. So, I mean, I've said all this, and I don't even. Well, we're about 12:40 now. Again, I would just bring us back to the point: the farmers markets are not silver bullets. They're not panaceas. I think they're excellent opportunities. They're fun places. They're recreational spaces. They're ways to bring food. They can be amazing social justice and food justice remedies, and educational spaces. But they're not going to solve all of our problems. Obviously, there's a lot of the collective issues, and I'd like to open the floor to discussion. But Megan, since I can't see anybody, because I'm the most unsavvy technological person, and my children just set off the smoke alarm in our house cooking something, I apologize. Can I turn it over to you, Megan, to facilitate the Q&A?
You bet. I'd welcome anyone who has any questions or comments to put them in the chat box if you don't feel comfortable unmuting. But if you do, you can go ahead and unmute, or feel free to raise your hand and I can call on you.
Fortunately, they got the smoke detector to quit beeping.
I make a comment? Is that okay?
Go ahead. Yeah, go ahead.
I appreciate you saying that farmers markets aren't for every community, because one of the things I'm supposed to be doing is working with farmers markets, and my one community wants nothing to do with them. We've tried several of them several different times across the board over years, and it's just a farming community. Those who farm don't want to use the farmers market. They prefer to use an at the street on your honor system of, you want 6 ears of corn, put it in the can, put the money in the can. And those who don't farm tend to have small gardens of their own because it's a farming community. And we've tried so many different times and in so many different ways and locations, and it just hasn't worked. So I appreciate that comment.
Thanks. I would fall in line with those people. I mean, that's where I go to buy our food, is through like an honor system farm stand. And I just want to throw out, like, if other people have tackled and have like found success in some like working through equity issues, please chime in so we can all learn from each other. Like, what's worked, or actually, I find I learn more from my failures than my successes. So what hasn't worked, and what lessons can we borrow from each other? How many of you, like, I guess I can't do a poll here, but is there anybody that has found something of particularly useful in decreasing, say, travel barriers or financial barriers for to engage their community?
Yeah, and if you want to answer Dr. Farmer's question in the chat, I'm more than happy to read out some of the answers.
Hey, Megan and Dr. Farmer, it's Naima. So I don't necessarily have a response to your prompt, Dr. Farmer, but I do have kind of a question for you. And this is a really interesting. The timing of this was actually, I think, really great, considering the presentation that we had last week from Jen Zuckerman from Duke, who talked about the various ways that sort of whiteness and white supremacy culture sort of shows up in food systems. And one thing that I've been really sitting with since that presentation is the sort of popularity in recent years of sort of community-driven solutions, but also I'm kind of speaking for myself on behalf of funders to fund mobile markets as sort of a solution to some of the transportation barriers that you've described. And I'm curious what your thoughts are on that, because I think that on the flip side of the potential to solve some transportation barriers, there is this sort of idea of kind of this top-down approach. Sort of what you're emphasizing here is that, farmers markets maybe are not for every community. So is this kind of prescribed approach really the best way to go for all communities? And has your research sort of revealed anything about how communities might receive mobile markets as kind of a solution to increase access to food? I know that was a mouthful.
Oh, no, I think it's a really good question, and please just call me James. But I think it's really important. We've never inquired about mobile markets. I've been part of conversations that we've discussed mobile markets, and I mean, I think the key thing is making sure that the people that this is affecting are at the table and are part of the decision-making process. I don't want to answer and be like, well, we need to have a mobile market go into this X community because like maybe they don't want it. And, so I think making sure that you're working in a collaborative fashion, you got people that have the time and privilege to work on these issues that can be part of our job. Like leading this conversation can be part of my job, but if I don't have the right people at the table that are also representing the community, then I think I've not done my work the right way. So I would say, mobile markets could be useful. I mean, the fact is they're going to, like, in the places that they have to be routinely going to certain areas so people can be dependent upon them. So essentially it's set up in a fashion that it'll be like a farmer's market in a sense that they have a reliable source to get food when they're successful. So I mean, you find the examples that are successful. I would just say always include the right, the people, the community within the conversation, if that makes sense. Which I would say when I first started, 10, 12 years ago, I would have been much less likely to even think that I needed to do that. I'd be like, oh, well, everybody needs this. Well, no, not everybody needs it. Not everybody wants it. And but I feel like if we don't engage at the community level, then even if there is a need, and even if there's some that want it, you're just not going to have the buy-in. And so in the long run, it's not going to be successful anyway.
Yeah, and Corey mentioned in the chat that she was thinking a very similar thing to Naima, especially when the presenter from last week, who is Jen Zuckerman, as Naima mentioned, said that it isn't always helpful to bring these things and then leave versus empowering those who already live and grow there to come up with their solutions. So I think, Dr. Farmer, you got at that same sentiment that Corey has expressed in the chat.
I'm sorry to have missed last week's presentation. It sounded like a fantastic opportunity. I apologize for the beeping.
You're okay. For everyone's benefit, we are having a part 2. We will publicize that and share that link around, but Jen will be coming back and joining us in July to finish out that conversation and to continue on in her presentation. So we're really excited to be able to offer that all to you and to welcome Jen back virtually to Indiana. Do we have any other questions or comments that we would like to discuss today around this topic? I know we have quite a few people from the farmers market community on this call with us today. Debbie says, thank you for a great presentation.
I appreciate the feedback. Sorry.
No, you're fine. Amy, the recording will be available from last week. I'm having to trim it and my computer is fighting with me, but as soon as my computer stops fighting with me, it will be up on our website. And I will send out the link to the first recording, but you can always find it on the Indiana Grown for Schools website page under webinar recordings when I announce and send out the link for Jen to rejoin us in July. So hopefully you can find it in one way or another.
And folks, if you ever want to talk about this, I'm happy to. Reach out to me. There's my email address. I can put my office number in there as well. Reach out to me. We can get on the phone and talk and brainstorm ideas. And I know there's a lot of great resources in this state. I see Amy posted a comment there. Yeah, I would say absolutely consider working with your extension folks in your county, as well as up in West. Yeah, and we're always have a lot of resources at your disposal through the State Department of Health. Everybody, tap into us, use us, and I'm happy to be supportive in any way I can.
Okay, well, I think if no one else has any other questions, we can wrap up 10 minutes early. Thank you for joining us today, Dr. Farmer. For everyone's benefit, this recording will be uploaded to the Indiana Grown for Schools website and can be shared widely. I will do my best to include resources, and as always, we'll include the contact information of Dr. Farmer. So if anyone has a reason or a desire to get in touch with him, you can do so easily through that platform. So thank you